blood pressure is also part of our recording skill. Write this down, the equipment you need in order to perform this skill for the examiner. You're going to need a blood pressure cuff. You're going to need a stethoscope, which will be provided for you, so you don't have to bring your own, because you are using the examiner's stethoscope, the double lumen stethoscope, the day of the GNA exam. All right. So blood pressure cuff, like we said, the stethoscope, all this will be here for you. Cotton balls and alcohol, okay, are equipment as well, so write that down. Sometimes when I'm testing students for GNE, when it gets to blood pressure, they bring the clock. The clock is only, the clock with the second hand is only for pulse and what? Respiration, all right? So do not get those things confused. This is my exam. I've looked on my exam form and it says measure and record blood pressure. This is what you will do once again. Hi, Ms. Nafisa, I'm here to take your blood pressure. Is that okay with you? Great. I have my equipment here, and the examiner will get up from their seats and come to the bedside of the patient to do the skill with me. Okay. But before I go any further, let me again, although I know your instructors taught you this, when you take a stethoscope, we said this is the diaphragm. This is the part that you're going to be placing on the brachial artery. Okay. So you're going to disinfect the diaphragm, and you would also disinfect the two earpieces. It's not the examiner's responsibility to disinfect the earpieces. You would disinfect it and hand one to her and keep one as well. Okay. Of course, this is our blood pressure cuff. We all know what a blood pressure cuff looks like. And when you take the blood pressure cuff, okay, we said this area is also very important. It's guiding you as to where, you might place the diaphragm of your stethoscope. It has Velcro. You always want to make sure that when you wrap the cuff, this area is facing you, okay? In order for you to hear the patient's blood pressure, you have to wrap the cuff correctly, okay? You also have this part like the blood pressure cuff. So on this area of your cuff, there are numbers here and there are lines here. Each line represents something. Each line, little tiny line, represents 2, okay? Whereas on your scale, each little line represents 1, okay? And then you would have a dark line that represents a 10, okay? And then we have the bulb here, and you have this dial here as well. Most of you have the blood pressure equipment. You bought it, you purchased it to practice with it. The more you practice, the easier it would become. Blood pressure, pulse, and respiration are acquired skills. You can't just do it once and say, oh great, I know how to do it. The more you do it, the better you will become, all right? So watch and learn. Now I'm gonna pretend I'm you. Like we said, you will not be speaking. You just come here, the examiner is up, you disinfect the diaphragm of your stethoscope, then you disinfect the 2 earpieces for you and the examiner, okay? When you get in your alcohol, try your best not to soak the cotton ball with too much alcohol. If that's the case, then I would advise for you to squeeze it out, or else your ears may start getting irritated. So again, I'm gonna stand here so you can see it actually, so that everybody has a perfect view. I would return my equipment and I'm just move this out of the way as well. We already learned from our lectures that when you're taking blood pressure, the patient's arm should be exposed. In this case, it's very easy, unless your classmate is wearing, a sweater underneath their uniform the day of the exam, you should be okay. But if they are wearing a sweater, then you would move it out of the way to expose the upper arm that's exposing the brachial artery. Okay, so that's what we're doing. Take my cuff and wrap it snugly. Remember that word, right? So this is what I'm doing, snugly. Sometimes again, when I'm testing students and they wrap the cuff and it's a tiny bit loose, they get all, bent out of shape, trying to take it off and wrap it again. Just do this, and the more you practice, the better you become, like I just said. All right, just like that, and it's facing you. Okay, you rest the patient's arm on the mattress. We said this part is what's going in contact with the brachial artery, so certainly you do not want to cover the brachial artery. Another thing that I would advise you to do, especially when it comes to blood pressure, we do not want to get this wrong, okay? We did not come this far, thank you, to fail our CNA exam. So if you think, oh, my back is gonna hurt, I'm really gonna be stressed, or I'll be putting too much stress on my back, then by all means you can bring the bed to a comfortable level for you, so you're not all the way down. But if you do that, then when you finish, you have to return to the lowest position for real. Take my earpiece, hand this to the examiner. Can I do it with you, please? I just want you to get a full picture that you can be here. Like, this is my examiner, that's how it's gonna look, okay? You do this. They are just here to listen with you. They're not doing any of the steps, okay? You place your hand at the brachial artery. Can you come down there, please? Okay. And you place this part on your client's chest so you and the examiner can see, okay? So I'm the student, I'm doing everything. She's just gonna watch and listen. Because we do not know each other's, because we do not know each other's blood pressure, you were taught to pump the blood pressure cuff all the way to 180, okay? Then you start coming down. My client in this case is very young, so her blood pressure is very low. Okay, thank you. So once I'm done, I keep the number in my mind. Okay, so you do the same thing without saying anything to the examiner. I unwrap the cuff, return my equipment where I got it from, quietly, not speaking to the examiner concerning my numbers. In my mind, okay. Cold lights. I brought the bed all the way up, so I have to return it to the lowest position for real in order to get credit for it. Call light is within reach. My bed is in the lowest position, and I'm going to wash my hands. Then I go to my recording sheet, and where it says blood pressure, once again I would record. I got 90/60. Okay, no letters behind it. I just write it down and I give it to my patient. examiner, you are done with the blood pressure. Okay, all right. Give yourselves a big round of applause. Thank you for your time.